Davila. Always a pleasure having you on Venu Health, and it's kind of if you've been out in the traffic and doing any holiday shopping, I think everybody is a little bit stressed out
Yes.
this time of year, right?
Oh yeah.
And
We were talking about this before. We always have the last day to do some extra shopping for people that we care.
exactly. And hey, we kind of joked about if we were done, just because we're men, and we have that last minute, who did I miss, or someone special, or just to be out there with the rest of the guys out there shopping. It's kind of funny for those last minute items. But one of the topics that you and I were chatting about here before the show was just stress in our workplace. And so you had sent me a clip, and I'm gonna play it real quick because it kind of leads to uh, what we're going to chat about today on the podcast. So it's talking about the most stressful job. How did that happen? That's the
Yeah, I know.
that's the
How that?
that is
Who
yours. That
knew?
is your specialty. Of course, third is healthcare workers, right? So that really encompasses everyone in the space, including people like myself that support the space. So you've been doing this for a very long time, and what are your techniques, and how do you get through the holiday, being that you rank number one as having the most stressful job in the country. And they probably didn't tell you that when you were going through medical school and your residency, that you were going to walk into that field.
That's right. That's right. I mean, that is the so important that you do what you like because imagine to do the rest of your life something that you don't like and now it's stressful.
Right.
So that is so important to everybody to always make decision about what you're going to dedicate your life is based on what you like. Saying that, I think that you exactly mentioned something that is true in medicine, in urology, in across the healthcare space, which is we have a significant increase of patients and less physicians. Okay. So by increasing the volume, I think that is one of the main problems that we have with the stress. So you have to see more and you feel that you have less help. Okay. So when you see increase your volume and you feel that you have less help, that balance is what is taking us to what we are seeing today, that the top three are related to medicine. In particular to urology, I think the problem is that America is becoming older, is aging. I think it's suspected that in 2030 will be more adults than children in the United States. So, and that is telling us that the country is aging. And of course, one of the main patients that look for urology care are usually above 65.
Right.
So the University of Michigan did a research back in 2021 and they review the workforce of urology per capita. And nowadays, back in 2019, we were about 4 urologists per 100,000, patients.
Patients. Wow.
So they projected, and is estimated that maybe in 2060, okay, 40 years later, if we don't do any change of the number of urologists that get into the workforce, so it will be 3 urologists, 3.1 per 100,000. So you will decreasing it 25% of urologists. That is concerning. Number two, so the median urology age nowadays is about 55. So based on the American Urology Association, and about 30% of the practicing urologists today 30% are 65 years old or older. So we have potentially 30% of the workforce of urologists may be retiring this year or next year.
Sure.
So it is alarming. Okay, so when you have to see more patients, you feel that you have less help, and then now you, as a patient, it's going to be extremely difficult to get access to urologists. So now we know the problem. What is the solution? So, well, let me start with an analogy, Robert, that maybe everybody can understand. So if you take Michael Jordan, okay, and you take Michael Jordan, and every year, okay, Michael Jordan have to play with four new players, okay. Every year, Chicago Bulls will have four new players for Michael Jordan to play. We wouldn't have the championships that he accomplished. We wouldn't have Michael Jordan. Why? Because consistency is so important in high performance. So you have to work with a team. What I have seen nowadays in the last maybe 5 or 7 years is hospitals, are not able to keep a consistent team in the OR
Right.
or in the hospital. So let me give you an example. So when I take my patient to the hospital, so I'm taking to the hospital myself with the skills that I have and my patient who trusts me. And everything else will be provided for me and my patient in terms of the anesthesiology, the nurses that are going to see you in pre-op, the nurses that are going to recover you, the nurses that are going to be helping us in the OR. Everything is provided. That team is provided by the hospital. But the hospital is failing. Before COVID, they were not retaining staff for more than 5 years. During COVID, that went downhill even faster. And after COVID, it's still more or less the same. There is not anymore. You cannot go to any hospital OR and find somebody who has been doing urology for more than 5 or 6 years. Everybody is moving around from one place to another. So now I come to the hospital to do a surgery. Let's go and see a simple surgery, a very simple surgery. But that person who is helping us doesn't have a clue what we're doing because she's just filling the space.
Right.
She's good in doing orthopedic
Right.
surgery, but she has never done urology. So a very simple procedure become very frustrating for you as a surgeon because the help that they're providing to you is not what you are expecting. And that is when I bring that analogy with Michael Jordan. So you need your players. You need to have a team that every time that you are playing, they know your game. As a surgeon, the way that I have done to overcome this problem is I hire my own surgical assistant. You met Cisco,
Yes.
okay?
Yep.
And then I hire him. So when I go to the hospital doesn't provide my surgical assistant. I pay my surgical assistant. He has been working for me for 5 years. So I get into the OR, a difficult case, an easy case. There is somebody, my Scottie Pippen is next to me.
That's right. And,
Okay,
and, and
so
I and I see that, because I'm fortunate enough to go to hospitals around the country, and I definitely see the difference between people that manage their hospital time like yourself, that they've got that surgical assistant, they have that same circulator, they have that same scrub tech, and the case is smooth and it goes beautifully. And then all of a sudden, what happens at 3 o'clock? Shift change, right? And unfortunately,
correct.
that's then when you start seeing even more movement. So you see people like yourself, you're always pushing to try to get everything done by 3 o'clock. It doesn't
Correct.
always happen that way, but at
Correct.
least in those scenarios, then it's like, okay, now I have to readjust again, and so
Correct.
that's
So,
a
and
lot of
that's
stress too.
exactly right. It's exactly right. So you You want to create a team. So Cisco, by being hired by me, so I'm in private practice, so I'm not employed by a hospital. So I'm able to do those decisions. And I say, okay, I'm going to hire a surgical assistant, and that person is with me every Monday, every Tuesday that I'm doing surgery, even when I'm on call, and I in the middle of the night on a Saturday, if I have to do a stent placement for somebody who has a stone, Cisco will be there, and he knows the stent that I'm using. He know everything. So by having that member of the team that is consistent, the performance is predictable, then everybody feel comfortable in the room.
Right.
So everybody want to be in our room because it's low, is a good energy, low stress,
That's right.
everything flow well, so we can do what we came to do without any problems. So I think that is one solution that I would recommend to the urologists that are feeling stress is don't wait for the hospital to create your team. Be proactive and create yourself your team. And even if it looks like expense at the beginning, which is you are hiring somebody that should be done by the hospital, it will certainly improve patient care, which is the most important, but it will not burn you out. It will not generate a stress that we want physicians to be able to practice for many, many years. And that is one advice that I give.
Uh,
Then another advice that I give, Robert, is so now you come to the office. I'm trying to tell you what are those places that physicians and urologists may feel stressed. We talk about the OR. We have a solution there possible that hiring your surgical assistant that will create consistency. Now we go to the office. So what I have seen in the last maybe 5 years, if you are employed by a hospital, then you say, well, they need to provide my team in the office. So what happened? Hospitals employing physician and now running practice is they're not able to retain in the office any staff for long term.
right.
What you are seeing in the OR is happening in the office too. Okay, and then you have urologists that in 3 years they have gone to maybe through 2 or 3 office managers. In 3 or 5 years, they have 5 different medical assistants helping them.
Right.
So of course,
Plus the front
that's
desk,
not.
right? Who's
Yes,
answering the phone? They don't know the your surgical scheduler, right? It's like a every
correct.
time
So
you call or
co-
you stop in,
correct.
it
So
changes.
so you need to be involved. And again, I'm in private practice. It's a different situation than being employed, but you have to participate in creating your team, and not only creating your team, but remember, when you pay a salary, that doesn't mean that they belong to a team. That only means that that person is going to be there from 8 to 5, maybe. But creating a team is not paying a salary. Creating a team is when you start spending time with them. So in my office, we celebrate birthday, we go out for lunch, we go out for movies, we do team building activities, we celebrate baby showers. I spend time with my team to the point that I enjoy that, and they enjoy that too. We do half marathon 5Ks. So you really need to feel comfortable. It's like, again, Michael Jordan. Okay, you play with your teammates and they're consistent, but you need to like them too. You
Sure.
need to get along too. And the only way to connect with them is you cannot connect with them in the middle of an NBA final. You need to connect with them during practice, outside practice. And it's the same here. So you need to not only have a team, but spend time with them. So go out, have lunch, do activities that they will say, okay, I have not only a salary, but I have a place that I feel comfortable. Challenge them to get a better education. We have LPM in my office that they're doing nurse practitioners, training courses now.
Yeah.
They're becoming nurse practitioner. We're providing some support for the tuitions. So we have surgical techs that are becoming surgical assistant. We provide help with the tuitions. So we do research. They participate in research. They present our research in a journal club. So you can challenge them. Now they have another reason to stay with you. So we need to understand, Robert, that we are not anymore that generation like, your dad or your grandfather, that by paying them a salary, they will stay there for 20 years. So nowadays, the new generations paying a salary is not the reason for which they will stay with you for 20 years. You have to provide many more reasons for them to stay with you. And I think the only way is not only to be well compensated, but as well to feel that they have a team and a family, that they can call you with a problem at 2 in the morning and you will help them. Okay.
Yep, absolutely.
So, and I think that if you do that, if you decrease the stress by improving the team mentality in the OR and in the office, I think that I have seen by doing those two things, I have seen a significantly decrease of my stress. Am I stress free? No. I mean, being a physician, you always care about your patient, your outcome. If somebody is not doing well, you're always thinking about them. So you always, before you go to sleep, you always thinking about your patients. That is what defines us as a physician, care. If you find a physician that doesn't care, you need to find another physician. So yes, there is a baseline stress for us because we care about our patient. But when we have a team of people that care in the same level for our patient, and we are together and we need to respond together to the same situation, I think it's a little bit easier.
Yeah, and I think that's a great point. Is that when because not all of the stress has to be shared by you, right? So if it's something with a prescription that someone else can handle, if it's something more, somewhere in the middle where you're PA, nurse practitioner, like it doesn't, everyone kind of has those little areas of responsibility, and so if it doesn't always fall back on you at the end of the day, then everyone is a lot better off because they know their job, they know their responsibility, they know that they can answer that. You give them coaching, guidance, autonomy to be able to make those decisions in your office. And of course, if you're unsure, they're going to reach out to you. So it's almost like you spread the stress a little bit. And I think sometimes
Correct.
when you have a low functioning team on both sides, OR and office, then that's where that stress ultimately, just like an officer in the military in a platoon, you're ultimately responsible.
Yep.
And so you've done a fabulous job at team building, looking at those levers that help reduce the stress. And I think that's why you're able to talk on a Friday afternoon.
Yeah, but I think it's if the American Urology Association and all the entities that need to look into these, they really need to put a high priority on this because I think that the number of physicians that are employed by hospitals and institutions is about 46% of the urology workforce is employed. Okay, and when you look private practice back in 2015, I think there was 63%, and now in 2019 is 53%. So it
right,
decreased 10% in 4 years. So, and remember what I say, 30% of the workforce is 65 or above. So how much of that 30% want to build a team
right.
at 65? So, for you, for me, Robert, that we still have many years in front of us doing what we like. Yes, we want to invest on that team. But if you're 65, maybe you say, this is it. So we really need to look, and I hope the hospitals start looking in a better way because they have become the main employer almost of physician. And I don't know the numbers outside urology, but I hope that they understand that running a practice and a hospital is not the same. Okay, and how you treat people in the business world, okay, is not the same way that you can treat healthcare employees. And if you trust, if you have a physician that you trust and that physician is let go by the hospital, you have a whole community now that has been affected by that. And I don't see that they see that picture that way. I think that they see everybody is replaceable, nurses are replaceable, physicians are replaceable, and that turnover is what we are seeing is not getting under control, is actually completely out of control because the only way that I feel safe in a place if I trust you. But if you fire somebody next to me that has been doing an equal job to me or better, so what do you think is going to happen to my trust?
Right. You're
You
like,
see,
oh,
so they
who's
don't
next?
see it in that way. So the more I talk with other physicians that are employed, I think it's a common problem that I hope that the hospitals understand that they have a responsibility in handling physician practice, and it's not only the practice. I will say this is my personal opinion. This is not based on any research, but do this, Robert. If you ask 10 physicians and you say why you became a physician, I would say that maybe 7 or 8 will give an answer similar to this. Number one, patient care, okay? And number two, autonomy. So if you ask a lot of the physicians, we like to be autonomous. We like to be independent, okay?
Right.
And when you become employed, you are throwing away one of the two reasons you became a physician, okay? And the only one that remained there is patient care. But then when they start handling your practice and patient doesn't have access to you, you don't have the team, now you're compromising the other things. So the two things for which you became a physician, they're being compromised by an employment position that doesn't have the same long-term value that I may have in private practice. Because every decision that I made, oh, I like female urology, oh, I'm going to be tailoring my practice to what I like.
Right.
It's not what the hospital is asking me to do. Is I tailor my practice in I talk to you, we can spend hours talking about what we like, is because we have a passion and we slowly start moving our career to that space. And sometimes when you are employed by a hospital, they push you for what they need.
Right. Right. They say, hey, here's the patient load. Right? These are the ones that aren't being seen.
Correct.
And you're you're pushed into that because you are now employed by the hospital. So you've got, think of the all these young urologists that are just finishing their residency or maybe they did a fellowship. What would be your advice to them?
Don't be afraid of private practice. Private practice can be a little bit intimidating for the new generation. For me, it's still a day-to-day learning process. But I think in the long term, a physician that remain independent and remain focused on patient care has a better, career fulfillment. And I think the stress that could potentially be a little higher because you think, oh, I'm going to be handling all my practice, but you're going to be so happy because your practice is going to be tailored for you, that initial stress that maybe the first 5 years will pay off
Right.
after the 5 years. So that delay gratification that we need to start building up, because the new generations, they want everything the first year. I want the nurse practitioner the first year. I want a surgical assistant. I want everything the first day that I'm working. It takes years to accomplish that. Okay. But if you put the 5 initial years, I bet you that you're going to be extremely happy after that.
So would you say to consider going out on your own, or would you say, hey, look for a urology practice and get teamed up because now you're going to learn the ropes in that
Correct.
environment?
That's an excellent question, Robert. Is the way that back in the 80s you were practicing private practice, you and your wife, those years are gone. They're not coming back. So when I'm talking about private practice, it has to be a group. So I think that the most important part is to trying to find a group of urologists to be able to practice in private practice. And when I say more than 10 urologists, at least is what I will consider a group that would be meaningful and helpful for you to establish yourself. In my case, I work in a group of physicians. We are 220 physicians, Florida cancer specialists, and these allow me to be able to do as many things I can as in private practice because we have a group.
Right.
And that group, we have 110 offices in Florida. We have 13 cancer centers. So we have a system that we have built based on our community needs in each one of these communities that we practice. But at the same time, we let the physician to build that practice based on their need. Oh, you want to be specializing more on breast cancer? That's great. Oh, you are a urologist and you want to be more of a female urology? That's great. So the physician is still have a decision process in a physician group. You see what I mean?
Yeah. But at least they get into and they have the coverage for the insurance. They have, that's the biggest one of the biggest challenges is making sure that you can get the coverage and that you're so that when people want to come see you, you have every plan available
Correct.
that says, okay, yes, we accept your insurance and
Correct.
Medicare, Medicaid, and all of those governmental
Correct.
entities that are the big hurdles when you get out of your residency.
Correct. So, but yeah, going to a group is better. You will learn the process with the seniors members of your group. But I always, when I talk with residents and fellow, please stay in private practice because, if you don't like academia, you don't want to be teaching, which is another place where we need another many urologists to stay in academia to teach the new generation.
Right.
But if you decide that that is not your call, I would say always look into private practice as the first option, even that the first 5 years will be challenging and maybe financially not as attractive as the hospital may look on paper, but the long-term happiness will be better.
What about I was thinking of different areas and specialties. What about the underserved? I know that different parts of the country are really hurting for specialists like yourself. That's also a place that a young physician could go to, and really, it, at least the feedback I get is that the hospitals are much more will work with the physician a lot more at
Correct.
what their needs
Yes,
are,
you're right.
desires, and maybe even income and such.
You're right. So rural areas are lacking in urology care. Most of these urology per capita that we were talking at the beginning, which is about 3.9 per 100,000, that doesn't apply for rural communities. I mean, this is small urban communities. So, and now the government and the AUA is trying to come with if you go to practice to an underserved area, they pay you some of the loan that you come from med school with. So, and that is trying to attract some specialists and among them the urologists to these areas that are underserved. I practice in Michigan, Robert, and I was in a small town called Tawas, and there is a tremendous need for specialists. And for 3 years, I did thousands of surgeries there. So, if you are a surgeon and you go to a place that needs a urologist, you are going to be doing a lot of surgery. So, The analogy that I give to the med students and the residents, remember, we're very similar to a pilot. The more hours you fly, the better the pilot is. It is the same with the surgeon.
Right.
You want to have a surgeon that is doing a lot of surgeries. So, and sometimes in those underserved areas, the volume that you get in 3 or 4 years is tremendous. So, and then you see the quality of life, it's not as expensive in the city. And so I would say yes, look into the underserved area as well, because even that is not maybe as attractive as the big city, but I mean, family, professional and financially can be more fulfilling.
No, absolutely. And you know, it's if you think about why you go into medicine, you know, those are always it's a great place to cut your teeth, so to speak. Doesn't mean you have to spend your entire life there, but it really serves a lot of purposes. You definitely improve your skill set, and you help a group of people that otherwise would struggle either a not get the help, or they're driving hundreds and hundreds of miles to try to uh, go into the bigger parts of the country and see the patient care that they want to receive. So thank you for sharing that. And I did not know that you had been up in Michigan, so that's a little hidden fact of where you knocked out a few thousand surgeries, right? Very quickly.
Oh yeah, oh yeah.
So thank you for your commitment to the space and to the field. Always great to have you on the program, and wishing you and your family a very happy and healthy holidays, and to a fantastic New Year's coming up here.
Same to you, Robert. You are a friend. It's always a pleasure talking to you. I wish you and your family the best for 2024. Merry Christmas, Happy New Year. Be safe, be careful.
Thank you. Talk soon.
Take care, my friend.
Bye
Take care.
bye.